All right, we are live. Welcome today, everyone. My name is Tim McMahon with St. Joseph Hospital, and today is part of our Meet the Expert series, where each week we interview an expert from St. Joseph Hospital in one of many departments. And this week we are interviewing Dr. Hassan Yameen from the St. Joseph Hospital Cancer Center. And Dr. Yameen will be talking to us all about endocrine therapy for breast cancer. So we're going to start off, Dr. Yameen, if you would just introduce yourself, tell us a little bit about your background, and kind of open up the topic for us today.
Sounds good. Thank you, Tim. So, hello, everyone. My name is Hassan Yameen. I work as a medical oncologist here at the Cancer Center at St. Joseph Hospital. I joined in 2019. I did my training in Boston, and I'm happy to be here. And today, we are going to talk about endocrine therapy, which is an important part of treatment in our breast cancer patients.
Great. Thank you, Dr. Yameen. Yeah. So we have a few questions we're going to be asking Dr. Yameen throughout this, probably 10 to 15-minute broadcast. But as viewers, if you have any questions that you would like to ask Dr. Yameen to answer live, feel free to post it in the comment section below, and we'll answer those towards the end of the broadcast. So to start off, one of the first questions that we want to ask is, what is endocrine therapy exactly?
Yes, so endocrine therapy is commonly known as hormonal therapy. It's basically very specific for quite a few types of cancers like prostate cancer and breast cancer, two of which are driven by our own hormones that exist in our body. Specifically in the case of breast cancer, we have female hormones, estrogen, progesterone, that kind of fuel breast cancer cells if they express the receptors for these hormones. So that kind of gives us a way to suppress the hormone levels, which kind of sort of cuts off the fuel for the cancer cells. And that's kind of the way endocrine therapy works, and it works great, much fewer side effects than traditional chemotherapy agents.
All right, so Dr. Yameen, does that kind of answer our next question, which was, how does endocrine therapy work, or is there more we can talk about that?
Yeah, I think that kind of hits two birds with the same stone. Endocrine therapy for most breast cancer cells express receptors for hormones, the estrogen receptor and the progesterone receptor, like up to 75% of breast cancer tumors. So for these cancers in which the receptor is positive, yes, so it depends on the class of treatment. Either the drug can go and block the receptor so the hormones don't act, or another class of drugs called aromatase inhibitors, they actually inhibit the production of estrogen. So ultimately the end result is the same. The cancer cannot feed upon the stimulating effect of the female hormones, which kind of causes them to kind of stop growing.
Okay, great. Thank you, doctor. Another question that we often hear is, for whom is endocrine therapy recommended?
Yes, so, and I think I kind of touched upon that as well. Up to 75% of breast cancers, which is the vast majority, they will express receptors for hormones, either or both progesterone and estrogen on the tumor cells on the surface. So for those, endocrine therapy works well. There are a minority of breast cancers which do not express either of these receptors, about 25% or less. And unfortunately, endocrine therapy does not work in those cancers. But for the vast majority, where there is high expression, especially in the tumor cells, the endocrine therapy is a good option.
Great, thank you. All right, another question here is, how is endocrine therapy given?
Yes, so there are a couple of, it's given by mouth. Most of the drugs are oral pills that people just can take at home once daily. There are a few endocrine therapy medications that's given as an injection, usually under the skin, like once a month or once every 3 months kind of thing. But most of the time we are talking about pills, and it's very simple, once a day. And endocrine therapy works for both people who have had early stage of breast cancer where they've received their surgery and radiation, and then we can give endocrine therapy to prevent, more from a preventive standpoint, to prevent the breast cancer from coming back in the future, either in the breast or elsewhere in the body. But we also use endocrine therapy for advanced breast cancer where um, it's more for the treatment to keep the cancer under control. So we use endocrine therapy in both of these types of patients.
Great, thank you. So to kind of play off that, how long is endocrine therapy needed for?
Yes, so for the first class of patients that I just mentioned, for after like early stage breast cancer, after they receive their definitive treatment, which can be surgery and radiation, and endocrine therapy is more of a preventive situation in that setting. The standard recommendation has been for 5 years, and there is more data that is coming up that taking endocrine therapy for even longer, like up to 8 years or even 10 years, as long as they can tolerate it without major side effects, then you can go up to 10 years, and any patient can choose that. And I think it works. The 10-year mark works. 10-year mark is a good recommendation for somebody who had a little bit of an advanced stage cancer, like bigger tumor, or positive lymph nodes. For those, I think the 10 years of endocrine therapy works even better to sort of have this preventive effect. For somebody who had like stage 1A cancer where the lymph nodes were clear and there was a tiny little tumor, then I mean, they'll still benefit from the longer 10-year duration, but the benefit may be less. So I think it kind of depends on a patient-to-patient basis. But at least for 5 years, but with the consideration of going up to 10 years.
Okay, great, thank you. So with that in mind, are there any side effects?
Yes. Most of the side effects are pretty manageable. A lot of people don't have any side effects, but because endocrine therapy kind of works by reducing the effect on the body of estrogen, so it's kind of very similar to menopausal symptoms, like hot flashes can happen, mood changes, like are among the most common side effects, and like certain metabolic changes, because estrogens are actually important in like managing like your cholesterol levels or blood pressure levels. So we found some people might have a little bit of difficulty keeping their cholesterol under control because they are on endocrine therapy, but it's usually not that big of an issue. And then depending on the class of endocrine therapy, there are certain side effects that are more common to certain classes. For example, aromatase inhibitors, which we commonly used in postmenopausal women. Joint pain, muscle pain is commonly reported, but usually quite manageable, and they actually diminish as the weeks go by. And then one of the biggest or most important side effects of aromatase inhibitors are loss of bone density or risk of osteoporosis, because estrogen is also very important in keeping bone mineral density and prevention of osteoporosis. So we actually kind of give preventive osteoporosis medications when we start these patients on aromatase inhibitors. And then for the other class, which is tamoxifen, there can be a slightly increased risk of blood clots, especially in smokers, which doesn't really exist for the aromatase inhibitors. And then another thing with tamoxifen is it has been reported to cause cataracts and other vision changes. And then also a slightly increased risk of uterine cancer with tamoxifen, but all of these are extremely rare side effects. The vast majority of women, go on tamoxifen or aromatase inhibitors without any major side effects.
Okay, thank you. Next question. Are there different types of endocrine therapy?
I think we kind of touched upon that as well. The two biggest classes are tamoxifen, which is kind of a receptor inhibitor, versus aromatase inhibitors. Some examples of aromatase inhibitors are anastrozole, which is also known as Arimidex, and then there's letrozole, which is also known as Femara, and then there's exemestane. So basically, tamoxifen acts by inhibiting the receptor, so estrogen doesn't bind to the receptor, while aromatase inhibitors, they inhibit an important enzyme that is involved in production of estrogen. So the way they work is different, but like I said before, the end result is kind of the same, preventing the stimulatory effect of estrogen on the breast cancer cells. And then there are a couple of other classes that are less commonly used. There's something called GnRH analogs, where those are usually given by injection under the skin. One of them is Lupron, that acts by sort of shutting off the estrogen production through acting on the pituitary gland. It's something we don't use as much, but yeah, that's a different class as well.
Okay. So a couple more questions, doctor. Our next question is, can endocrine therapy be given with other types of cancer treatments?
So other types of cancer treatments, yes. So usually endocrine therapy, we start endocrine therapy about like 4 weeks after the surgery is done to remove the breast cancer. And then endocrine therapy can definitely be given during the radiation portion. There's no reason not to start both together and then just continuing endocrine therapy after the radiation is done. They are not known to really interact with each other or cause major side effects. So a patient can choose to wait until the radiation part is done to start, or there's no reason not to just start the hormone pill along with the radiation. And then we also, mostly in the advanced stage setting where we are kind of giving endocrine therapy to keep things under control, we can also combine endocrine therapy with certain other cancer treatments, like abemaciclib, which is kind of like not a chemotherapy pill, but a more of a targeted treatment. We commonly combine endocrine therapy with those type of targeted therapies as well.
Okay, great. And I have one final question before we kind of wrap things up here, and that is, what things need to be monitored while on endocrine therapy?
Yes, so endocrine therapy, like I said before, is very well tolerated, much better tolerated than traditional chemotherapy agents. So there's not much we have to really closely monitor. But we always tell patients on endocrine therapy to make sure they follow closely with their primary care, to make sure their like other general health issues are under control, like specifically cholesterol, blood pressure, because these things can go a little bit off when people are on endocrine therapy because of the reduction of estrogen levels. And then for people on tamoxifen, we always tell them, because there's a very slight risk of uterine cancer if they have a uterus, they should, if there's any abnormal bleeding, they should see their gynecologist, or even if nothing is going on, they should see their gynecologist at least once a year. And same with the eye doctor or the ophthalmologist, because tamoxifen can lead to an increase in risk of cataracts and other vision changes. So once a year eye doctor visit just to make sure things are going okay. And then for people on aromatase inhibitors, because of their specific side effect of increase in the risk of osteoporosis, we monitor their bone density with the DEXA scan or bone density scan at least every 2 years, and we recommend people to take a calcium and vitamin D supplement and do weight-bearing exercises while they are on aromatase inhibitors to keep the bone strong.
Great. And just to wrap things up, Dr. Yameen, if there's somebody watching this broadcast right now that is interested in learning more about endocrine therapy or has additional questions, what should they do?
Well, there are a lot of patient information sites for endocrine therapy as well as other cancer treatments. One website we commonly refer people to is chemocare.com. It's in layman's language without any medical jargon or technical terms. I think we all often print out um, details of different drugs from that website and give to patients to read. And of course, we are always there as well. They can feel free to reach out to us on the phone, through my chart. We are always available to answer any questions and refer them to more resources.
Great. Well, thank you again, Dr. Yameen. We really appreciate you taking the time to talk to our audience about endocrine therapy for breast cancer. And to our audience members, we thank you for joining in with us today, once again on our Meet the Expert series. And again, we do this every week, new experts each week, new topics, new departments, new services. So we look forward to seeing you again next week when we'll have a new provider on here as well. So thank you again, Dr. Yameen, and thank you everyone for watching.
Thank you, Tim. My pleasure.